Now, the world of triathlon and endurance sports runs rampant with sun damage. You know, it's hard. We are trying really hard to balance training with everything else going on in our life, that it's sometimes hard to take care of ourselves and our skin the way that we should. We do our best to wear our hats and sunglasses and apply sunscreen, but one of the best things we can do for our skin is to actually have a skin cancer screening done once a year. Now, some of my friends express a little bit of anxiety with regards to having a skin cancer screening, and I suspect they're not alone, so allow me to walk you through what to expect. First of all, I would always recommend that you arrive at your skin cancer check with as little impeding your skin as possible. That means things like jewelry, makeup, tinted sunscreen, nail polish. All of those things can cover up areas where there could be potential for skin cancer. When you are brought into the room, you're going to be asked to change into a drape or a gown. You'll also be given the option to leave on the underwear. Now, generally, we'll start with the scalp and work our way down, and we'll check all of your skin. That includes inside of your mouth, it includes between the toes, and most of the time, you will be given an option by your provider as to whether or not you would like to have the genital area looked at. We absolutely respect our patients' modesty, and if that's not something you're comfortable with, then we won't check there. But I do always recommend it's important to do self-screenings, because in the case of melanoma especially, it's no respecter of place on the skin. In other words, it can show up anywhere even if there's no sun exposure. So what I'll typically do is use my little tool called a dermatoscope. It looks something like this. What it basically does is allows me to illuminate and magnify lesions to give a little bit of a better idea of what's taking place. Oftentimes I'll be calling out lesions, which might sound a little foreign to patients, but I do that so that we can chart exactly where your spots are, so that as you come in for subsequent visits, we have something to compare it to. Now, if a lesion looks suspicious or a little bit different to me, I may opt to do one of two things. The first thing that we can do is simply observe it. We may decide to take a picture, measure it, and have you come back in a few months' time to see if it's changed or grown. The other thing is, if there's just a lot of red flags or I'm really concerned about a lesion, we may decide to biopsy. And biopsies are going to be done in one of two ways. Either we'll perform a shave procedure where we literally just shave off the lesion, or we may opt to take a little piece of the lesion, a little kind of circular piece, so that we can see a little bit deeper to that lesion. At the conclusion of the visit, we will basically review everything that we found, certainly answer any patient's questions, and talk about where we could potentially step up sunscreen if needed. And that's about it. It takes about 15 minutes or so to do a good, thorough skin check. And again, it's nothing to be intimidated about. You know, this is something that we do every day. I realize patients sometimes can feel nervous and vulnerable, so we do our very best to make them feel at ease, and we recommend that patients come in once a year to have that skin check done.